Hey, what's up guys? So we're gonna try something new. We get a ton of questions and I don't always get to them, so I wanna make sure to I'll answer some questions now and hopefully that's better than just a DM message. So we got questions about the post from yesterday, right?
Mm-hmm. So the first question is from Saulo Chaula, sorry if I'm saying your name wrong. He asked, so you can place it at 1.5 millimeters below the bone level?
Oh, we got a special guest actually.
Ooh,
hey, it's my dad. Come in, Dad. Say hi. Say hi. He's turning the camera towards you. Where are you walking up? There he is. So anyway, the tip that we posted yesterday was that we want to go prep 1.5 millimeters below bone level. And so what was the question again from Sala?
So he's basically asking, so you can do that?
Prep one. So you place one. Okay, so we want to clarify just a little bit. So here's the bone level. You see that okay? All right, here's the bone level when you're prepping. Come on. Oh, that's me. All right, so say you're placing an 8 millimeter implant in here. You want to prep an additional 1.5 down here. So prep extra right here, 1.5. Just so you can make sure to get the implant down to this bone level. You're not gonna be submerging it 1.5. Right, you're not going to submerge it 1.5 millimeters. I submerge my implants 0.5 or so, just to make sure it's really below bone level. But the reason for this extra prepping is just so that you make sure that you actually get to the right depth. Because if you only prep exactly 8 and you're placing an 8, there's a chance that you might end up your implant's at that level and you keep trying to turn it and it'll be a spinner and it'll stay in place. So yeah, so you can prep extra 1.5, but don't place it. Or I'm not advocating placing 1.5 lower. Okay. Although some people do.
I got a question on that.
Oh, okay. My dad's got a question, so go ahead.
On your implant, it's not really aggressive at the tip.
Uh-huh.
And so it's protecting you from going too fast. So that's why you have to over prep. Because there are some implants that they are really aggressive that you can go and they keep going through the sinus or whatever.
Yeah, so that's a good point. So he's talking about the Implant Club implants. They have a rounded apex. They don't have a cutting apex like a Nobel Biocare or something like that, like an active. He's talking about this part right here. So what you don't want is a sharp apex, right? You want a rounded or flat. But yeah, that's why you do have to make sure to prep a little bit deeper so your implant can fit at the level you want it to go. All right, is that good? Yeah. I think we're good.
All right, next question is from Michael Zende. He said that I'm assuming by over prepping you will guarantee that the implant will go to the proper depth the first time.
Exactly.
How many times when you first started placing implants did you under prep? It says it adds so much time to the procedure when you have to remove the implant just to drill a little bit deeper.
Right. Okay, so that's exactly it. You're just prepping a little extra so you make sure that you get the implant to the proper depth. Drilling to the proper depth or a little bit extra takes no time at all if it's your regular protocol, right? So regular protocol, just prepping a little bit extra each time. Yeah, if you actually place your implant and then you have to take it out and then you have to prep more, that takes a bunch of time, and then your implant, you have to set your implant down somewhere. It might fall over, it might get contaminated. So best to just do it right out of the gate.
Follow-up question from Michael is asking about removing a stripped healing abutment. Okay,
strip healing abutments. So they don't usually get stripped very often. Actually, that's not a really common question. More like abutments. Abutment screws get stripped, but there's a stripped healing abutment. Really the easiest thing to do is to just take a little 330 burr, cut a slot on it, and then just take an elevator and just twist it out. So that's probably the easiest thing to do. There's also screw removal tools, but not everybody has those in their office. So I just take a little 330 burr, cut a slice, and then just get a tool to twist it off.
Okay. Just one.
Yeah, go ahead. You got more questions. Go ahead.
On the previous question, how many times when you remove the implant to put in a proper position, sometimes it might take another 10, 15 minutes. But if you don't do it, I have cases that they stuck in my mind for years, thinking why I didn't do it.
Yeah, that's a good point. So that's a really good point. So something I actually learned from my dad is if you have a hesitation about your case, fix it right there. If you let the patient go home, you're going to think about it all night. And you're going to maybe even call them back later and say, hey, come back in. And you're going to be so embarrassed making that call. So my dad actually taught me, even if you have a patient that you're supposed to go see, that you're already backed up on your schedule, just take the extra 15 minutes. Make sure you feel good about the case before you let them go. Yeah, that's pretty much it.
But
Yeah.
minimize it.
All right, see ya. See ya. Have a good lunch. All right, next question.
All right, we have a question from Bat Dentist, Dr. Hayran. What's up?
What's up, Josh?
He has a patient that has a lot of work that needs to be done, but wants dental implants for number 24 to 25. There was only room for one implant. He was wondering if anyone had any experience placing one implant and having 2 teeth on it. He was planning on placing a 3.7 by 10 implant. Other implants and treatments will be needed, but that's his plan.
Okay, so he's got a case where 24, 25, only space for one implant. So that's what's called a cantilever. So when you got 2 teeth on one implant, it's basically here, let me draw a picture of it actually. All right, so you have teeth here, and right here you're supposed to have 2 teeth, but down here maybe the bone is not enough space for 2 implants. You can only put 1 implant. So if you put 1 implant, usually 1 implant supports 1 tooth. But if one implant supports 2 teeth, it's called a cantilever, right? So this part is called a cantilever bridge, basically. So you have an unsupported tooth there. So the only time I would ever suggest really doing that is in the anterior mandibular incisor area. So exactly where you're talking about, Josh. So yeah, it's totally possible to do it there. Put the implant not in the middle because the embrasure is going to be crap. So just put it ideally for 1 tooth, and then you can just have the lab make it so there's 2 teeth that screw down on there. Any other place in the mouth, having a cantilever like that is really going to cause screw loosening issues, and there's already those issues happening often enough with implants. So trying to avoid any cantilevers is really the name of the game with restorative implant dentistry. So for this case, I'd say it's fine, but for any other cases, I'd probably try to avoid it. Is that it?
Yeah,
That's all the questions? I guess that's it, guys. Hope you like this new format. All right.